Welcome to the Daybreak Star Radio Network. Our motto, something that we're very, very excited about here, that we work so hard to continue to achieve, is our slogan, our motto, indigenize in the airways, 24/7, 365. Not a second goes by that we're not, believing in that important message here for our team. I'm Harris. I'm joined by Sherry, and we're here honored to talk to Dr. Gary Ferguson. Thank you for joining us this morning.
Good morning. Thank you. Thanks for having me.
Thank you.
Can you tell everybody who you are, your tribal affiliation, and what it is you do?
Great. So I'm Gary Ferguson. I work for Washington State University in a research institute called the Institute for Research and Education to Advance Community Health, or IREACH. We focus on health equity in our Indigenous communities and addressing our health disparities. And I serve as the Director of Outreach and Engagement, and I'm faculty here. We're located in the Elson S. Floyd College of Medicine.
Could you please let our listeners all over the world, Doctor, and explain what drove you, the passion, the excitement to become a physician, and how you made that dream possible for you?
Totally. So I'm originally from a small fishing community in the Aleut Islands called Sandpoint in the Shumagin Islands, and Unangax, or otherwise known as Aleut, is what the colonizers called us. And some of us still love our Aleut name, but we're Unangax, and I'm an enrolled member of the Qagan Tayagunin Tribe, which is our tribe on the island. And I never really thought that I could become a doctor, actually. Growing up there, didn't really see a whole lot of people who looked like me or who were from the area who pursued higher education. Even college was something that was very rare to see for many of us who grew up on the island. And at the same time, I had some really great mentors and teachers who inspired me and helped me to think bigger than necessarily just staying on the island. Although I have a lot of family and friends who have stayed on the island and done amazing things, and commercial fishing is our way of life there. And I still have a lot of family who are commercial fishermen. I just found that necessarily wasn't what I wanted to do for the rest of my life, and really wanted to make a difference in my community to help make it healthier, as well as my family and the challenges we faced health-wise. I thought that there was something we could do better. And so I've sought that change and continue to have passion around making our future generations have healthier lifestyles, or at least have the ability to have healthier lifestyles, as well as to have a healthcare system that works for them.
Thank you very much.
Well, that leads us right into what is IREACH?
So that's a great question, and I'm so happy to talk about IREACH. I first was exposed to IREACH, which was in Partnership for Native Health, which was at University of Washington, and IREACH actually moved over to Washington State University College of Medicine about 6 years ago, just a better terrain for rural and underserved health populations, and also Dr. Elson S. Floyd, who helped champion that effort at the college, really had a passion for making sure that diversity, equity, and inclusion was a priority for our healthcare systems, and also really addressing those challenges that we face in rural and underserved and our Indigenous populations. There was a couple of research projects that I got to participate in. I was then I was working at the Alaska Native Tribal Health Consortium, where I was in leadership, but also helping to be a co-investigator on some of these research projects related to healthy workplace environments, and a big passion of mine around traditional foods. And so Partnerships for Native Health was a great partner in helping to flesh out some research ideas and participate as a co-investigator. And then it was a pandemic, and I was doing a lot of village work, which there was no travel. And Dr. Deja Buchwald, who started the initiative here about 25 years ago, which now is an institute, she said, what are you doing? And I'm like, well, we've got a 2-year-old. So then he was 1-year-old, and I'm enjoying being a stay-at-home parent and having time for George Martin, but I also feel like I need to get some work done. I want to go back to work, and I can't travel because of the pandemic. And she's like, well, come on down, and we got work for you, as well as, just the passion of the Institute around really moving upstream and addressing some of those more difficult, more recalcitrant challenges in our Native communities. Like, how do we really move the dial on healthcare that is culturally competent and humble? How do we move the dial on some of these health disparities that continue to not move, despite lots of money being thrown at it? So to me, research really is the place to go. Like, how do we understand what works? And also, how do we understand what our tribal members and leaders want? And so to me, that research is the place that we need to understand how we address these health disparities and actually move the dial.
Awesome. Dr. Ferguson, if you could also explain how IREACH and what IREACH does for all the tribal communities out there on the education, training, and outreach for people that really do need the help and the assistance.
Yeah, so totally. So, a lot of folks have interacted with some of our programs over the years. When I was first getting aware of the efforts here at IREACH, it was Native People for Cancer Control at that time, which was a large NIH-funded project that was addressing cancer disparities. And there still continues to be opportunities to address cancer disparities through some of our research. But what I really was exposed to as far as this deeper work in the Native community in helping to bring community health priorities forward. And I have a couple of research projects that I want to give shout outs to as well, for folks that are maybe online to be able to maybe participate in. And I know that we have listeners all over the country and the world, but I'm going to give an opportunity for those in Washington State. And this is a research project related to addressing cancer disparities and treatment of cancer. And there's a couple of statistics. We have about 500 American Indian Alaska Native people in Washington that receive a new cancer diagnosis every year. And that actually, those numbers might be higher because of some of us who don't necessarily claim our Indigenous heritage, but maybe mixed heritage. So it's definitely an area of opportunity. And when we look at cancer health disparities, cancer is the leading cause of death for female and second for males. And we do have disparities in our Native communities. So this is a collaboration with Washington State University, the Cooney Foundation, and University of Washington's Department of Radiation Oncology, looking at how do we address radiation oncology and access to these life-saving treatments. And then from a provider perspective, from a patient perspective. And so there's opportunities to participate in just a 30-minute survey about cancer care. And so I'm going to give a couple of numbers here for those who are listeners. So Jolene is at 206-616-0546, or Kim at 206-708-8673 to talk to them about eligibility. There's a $50 honorarium exactly for being a participant in that study, but really important to look at what's working, what's not working. Some of the work we've done over the last several years is looking at access to screening for cancer, and there are disparities there, especially in rural communities, access to cancer treatment. And I'm from Alaska, and you have to travel, like my home region, you literally have to travel 1,000 miles to get to cancer treatment at the hospital in Anchorage from the Aleutian region. So, folks have to go through a huge amount of effort to make it there. There's weather. If you're an elder and you have a disability, it's much more difficult to get access. Here in Washington, I know that we have roads everywhere, but still there are disparities in the Pacific Northwest in access to these life-saving treatments. So that's one of the opportunities that we're doing research in, along with our other partners. And then there's another opportunity for those of us who have Alzheimer's disease or related dementia in our families. We do a lot of work in that space. There's one large center grant that we got recently called the Natives Engaged in Alzheimer's Research, called NEAR. And as a part of that, we have some outreach looking at provider training to properly assess Alzheimer's disease and related dementia for primary care physicians. And so that's a training that is available for tribal health entities. And so if you want to participate, you can get a hold of me, and we'd love to connect the dots for that project, as well as for folks who may have Alzheimer's disease or related dementia in their family and would like to be a part of clinical research. We have a partnership with the University of Washington on that project and the Alzheimer's Disease Research Center. So if that's in your space, we'd love to hear from you and connect the dots to see if you would be eligible for some of those clinical trials or studies. And then also we have something that was actually at Daybreak Star facility here a couple of months ago. We had our Brain Train event, which is also part of the NEAR initiative, where we're educating folks about Alzheimer's disease and related dementia. Many of the participants gave a saliva sample to look at maybe risks, genetic risks, and also learned a lot about research in how to understand Alzheimer's disease and related dementia, and what can we do to prevent it. I mean, I'm a naturopathic physician by training, and I believe in food as medicine and our indigenous ways of knowing and healing, and ways that we can stay healthy and vital as long as we live, right? And also do prevention-based approaches, which I think that's the best way to do it. And at the same time, some of us have predisposition to Alzheimer's disease and related dementia. So we want to make sure we stay ahead of that, assess our risks. And then also, maybe you need to amp up certain nutrients in your diet or lifestyle factors to make sure that you can prevent it or slow the progress if you're someone that is a high risk. So those are a couple of the areas we work in. We work in community addressing what's important to our Native communities. Research is something that elders are saying we want to understand about water and climate change and these other areas that we have some amazing scientists within Washington State University that we collaborate with. So regardless of the topic, if it's a priority in Native communities, we want to address that. So that's an opportunity as I get out in our Native communities. I'm newer to Washington, but I've got a lot of family down here. We actually have over 1,000 Unangax who live in Washington State. So we have a lot of tribal members who live in Washington as well. So I've got a large community here that I connect with and appreciate that being so far from home. But I feel like I'm home here on so many levels, as well as I get out in our Native communities and really have appreciated the welcoming spirit that the tribal nations here in Washington have given me.
Thank you so much for all your work. For people who may not understand why it's important, can you just say why it's important for Native peoples to have a voice at the table, and specifically in medical industry?
So I heard this quote a couple of years ago, and it really resonated with me. And I think it plays out in history. But it says, if you're not at the table, you might be on the menu. And I really feel like, we historically haven't been at the table in some of these large decisions that are made related to, you name it, from our food system to our environment to healthcare. I see us reclaiming our traditional approaches to health and healing, which is a big passion of mine, as we look at our ceremonies, as we look at our language, our culture as medicine. And that's something that's also really alive and well here at Washington State University. I work very closely with Dr. Naomi Bender, the Center for Native American Health Sciences, and working with our pharmacy, medicine, and nursing students and allied healthcare students, and especially our Indigenous students, in helping them to have the resources they need to become doctors and nurses and pharmacists and healthcare providers in our communities, because we need to have more people from our communities serving our communities. Similar to research, here at IREACH, we've trained over 50 Native investigators, PhD levels, that are out across the nation doing amazing work in their home communities and also other Native communities. So it's important to train up our own, to grow our own. And, historically, we just haven't been at the table, and, we're still, a very small percentage of providers in our clinics. And so I feel like the more that we have Indigenous healthcare professionals trained and ready to serve. And that's also one where, Washington State University's College of Medicine has a specific focus on Washington State. So if you're a physician there and you go through the training, the goal is to have you stay in Washington. And I think many states have a challenge. Their tribal members go out, they get training, and then they don't come home. And so how do we keep our folks home, and how do we incentivize them to come and be a leader at home and a healthcare provider and making a difference in our Native community? But when we look at research historically, some of our studies have not had enough folks who are from our Indigenous communities. And so as a result, the research is skewed. And is it really applicable to Native people? Some of the early vaccine studies, like the HPV studies looking at human papillomavirus and prevention, didn't have enough Native women involved. And so there were a couple of specific strains that weren't as a part of the initial vaccines because we didn't have those numbers. And so now we do have those numbers and things have modified, but we could have prevented that by having more Native people involved in those studies. And, historically, there's a reason for, reticence to be involved in research, right? We've had unethical research. We've had folks come in and take information from our communities and share it in a way that wasn't cogent with our values or our protocols. So I feel like there's good reason for that. And at the same time, like those of us who are Indigenous researchers and really promoting Indigenous health in our communities, we're sensitive to that, and we go through lengths to make sure that it is safe for communities, and the communities always have the ability to withdraw from a study or participate. And the goal is to help them understand what's involved and what are the risks, and also what are the benefits. I mean, I think in the end, we want to see our future generations be as healthy as possible. And the only way we're going to do that is if we do this preventive-based approach, as well as if we understand what works, and then also what isn't working. Like I was at the Association of American Indian Physicians conference recently, and Dr. Don Warren was just sharing, we've been spending a lot of money at some of these very difficult chronic diseases, and we're not seeing the numbers change. So it's not working. So as intelligent people here and as leaders, we need to say, why isn't it working? And what will work? And how do we have more culturally competent, culturally humble healthcare and in ways that we help our people move beyond and really heal from some of these difficult things that, are causing us to die at younger ages.
I agree with all of that. I really like your HPV vaccine example, because that shows how if more Native people had been included, it would have been a better vaccine for everybody from the beginning. It's such a simple inclusion and such a simple fix to something that will literally help all people. Thank you for that example.
Yeah, and similar to that, we had some tribal nations step up early on in the COVID vaccine trials, and I think we're starting to see a culture shift and wanting to be a part of research. And I think that's thanks to tribal leaders who are outspoken and helping to educate communities about the value of participating in research. And also, as we move forward, we always need to stay vigilant that, we protect ourselves and we ask the questions. And, those of us who have tribal oversight for research in our Native communities, that we use those bodies to help us better understand, the impacts. And sometimes the things that we don't realize will be impacts on our community or our elders or our youth. So I feel like it's always important to stay vigilant, but I think we need to participate. We actually need to run with our own research agenda, and that's my goal. It's like, in the end, I would like to have Indigenous nations come to me and say, this is what we want to research. This is our priority, and help us find the money. I think that's the ideal format, rather than us coming to Native communities saying, here's the money we have. Would you like to participate? That's a little bit late in the game as far as I'm concerned. However, we do our best.
Right. It's a step in the right direction.
Exactly.
I have a 3-part question. I'll try to be as clear here and as precise as I can. First is, have you ever applied for a grant or received a grant in your research? Ever applied specifically for a King County grant? And what was the process like? And was there any recommendations that you would give to others that are looking to achieve the same results?
So yes, I've applied for grants for many over the years, and varying levels of funding from large funding bodies like NIH to the local bodies like the Rasmussen Foundation in Alaska. So I've participated for many years in going forward with grants, and have worked for organizations, nonprofits that have their majority of their funding comes from grants. And specifically for King County, like, I haven't done a lot of work in Washington yet. I know our institute has, and of course has partnered up with many Washington entities, including King County. And so I would say that that's an area that I'm still getting my feet wet in as far as the local presence. And our goal really is to have more research within Washington State.
Right.
Our Washington State University and IREACH, historically at UW at least, we of course have had many center grants, and we're actually in 19 states right now working in Native communities throughout the country. So we have a large presence externally, and in Washington we do have like the CUNY Inroads grant that I mentioned related to cancer health disparities. So that is here in Washington, and we're really working to advance our research agenda within our Washington tribal nations, and that's the goal over the next year, is to get out there and visit with all of our 29 federally recognized tribes and those that aren't as well, which I think is important, to make sure that we're listening and connecting. And my next year is hitting the road and visiting with each one of our tribal nations around their research priorities and agendas, as well as to get them engaged with our current research.
Thank you.
That is a wonderful goal.
Yes.
Yeah.
We wish you much success.
Thank you.
So what advice would you give to Native youth who are thinking about possibly going into the medical field on any level? Like, for somebody who came from a place who maybe that wasn't necessarily an option for most people, what advice would you give them? So
I would say start early and look for opportunities. There are some really great opportunities. I was actually at Seattle Children's yesterday, and they have these amazing programs for high school youth on science and STEM careers, science, technology, education, and math. We have the Nahajni program here at Washington State University, which is a summer intensive for those who are pursuing health careers. There's a lot of opportunity, and I think getting in and starting very young, like I actually had this cool program that when I was a kid, it's no longer in Alaska. It's called the Rural Student Vocational Program, where I went in and studied health careers for 3 weeks and rotated through, saw surgeries and worked with occupational therapy and a bunch of different healthcare professions. And it really inspired me. At that point in time, I didn't realize the layering it would be in my brain. And because now I'm in healthcare, but I would say that those types of programs are transformational in helping you understand and be inspired by like what's out there. Like for many of us who live in small communities, we don't even know what's out there as far as health careers or a place that might be really inspirational for us. And I feel like these programs, for those in Alaska, there's the Alaska Native Science and Engineering program, which goes down into grade school to participate in summer intensives. There's more and more programs like this. And I think it's an opportunity, especially for Native youth, to step forward and be involved and be inspired by these programs, and to look for mentors. It's like I've had some amazing mentors who become friends and now colleagues over the years. And that to me, I think of like Mr. Career, my high school coach, and his inspiration, just, being in my body and being healthy. Mrs. Steinbrecher, our music teacher, who inspired me to stay in music. And, all of these people that have helped me see a bigger picture for myself and to think bigger and to, think impact in your life. So I think, mentors are great, and to really reach out, ask for support. And these amazing summer programs are available year round. Feel free if you're a youth and you've heard this program and you're looking for options, I'd be happy to connect dots. So feel free to email me, and there are a lot of really cool opportunities.
Yeah, we'll put all your info in the post as well for kids to get to, and everyone. Yeah.
Thank you very much, Doctor, and we're looking forward to being an alliance for you. And if there's any future partnerships that we can help create with our relationships here at Daybreak Star Radio Network, we'd be honored to help. But, that's why we're here. That's why the station is here.
Thank you. It's so awesome to participate today. Thanks for having me and for allowing me to have my voice at the table here around these opportunities. And again, my information will be available here as a part of the show. Feel free to reach out if you're a tribal member and you're interested in research and anything that I mentioned today. We'd be happy to connect the dots for you.
Thank you very much.
Thank you. Have a wonderful rest of your day.
Kagasakuk, thank you so much. Really appreciate the time.